constipation one day, diarrhea the next. They may sound like strange symptoms to go together, but as 1 in 5 Americans can attest, this is common for sufferers of IBS.
Irritable bowel syndrome, or IBS, is an intestinal disorder that manifests as a variety of unpleasant symptoms. As many as 1 in 5 American adults suffer from this incurable condition. Although IBS is a lifelong problem, it does not cause the serious intestinal changes that other digestive conditions, such as Crohn's disease, do. A common complaint among IBS sufferers is abdominal pain or cramping, which is often relieved by a bowel movement. People with IBS also experience diarrhea or constipation, often alternating between bouts of the loose watery stools of diarrhea and the painful hard ones of constipation. Gas and bloating are also almost always cited as symptoms. In addition, some sufferers notice mucus in their stools or experience the unpleasant sensation that their bowels have not emptied fully. All in all, IBS is often embarrassing and can be debilitating to sufferers who have severe symptoms. So, what causes this intestinal upset? There is no definitive answer. However, many researchers suspect that IBS may stem from the faulty communication between the brain and the intestinal tract. The walls of the intestine are lined with muscles that normally follow the brain's instructions to contract and relax rhythmically as they move food through the system. But if communication between the brain and the digestive system is poor, as is true of people with IBS, the contractions may speed up and force food through the intestines too quickly, resulting in diarrhea. Or the contractions may slow down, causing food to move too slowly, resulting in constipation. Doctors also theorize that IBS can stem from hormonal changes. One piece of evidence to support this is that women are twice as likely as men to experience symptoms, particularly during menstruation. It has also been noted that people with panic disorder or other psychological conditions, like depression, may be more likely to have IBS. Flare-ups of IBS may also occur after exposure to irritants or triggers, including certain medications and food. For example, some people may be intolerant to lactose or milk sugar, or may find that medications like antibiotics cause flare-ups. In addition, emotional stress is often related to colon spasms, which can trigger IBS symptoms in many patients. Although the cause of IBS remains ambiguous, it does have consistent patterns of incidence. Most cases occur among members of the same family and frequently before the age of 35. IBS can be embarrassing. Indeed, up to 70% of patients do not seek treatment for their symptoms. While irritable bowel syndrome can be frustrating, easing the unpleasant symptoms of the condition is entirely possible. For this reason, please speak with your doctor if you have concerns about IBS.